If you have been diagnosed with severe knee osteoarthritis, what doctors call as grade 3 or grade 4 osteoarthritis, you are likely facing a tough choice. You've been told you need a knee replacement, but you are looking for alternatives, probably because of some bad stories from our neighbors, friends, relatives. You probably heard about PRP, Platelet Rich Plasma. Here's PRP. PRP is easily produced in the clinic, it is given by many doctors. PRP is the standard orthobiologic treatment. But is PRP enough for your severe condition? Here is an X-ray comparing grade 1 osteoarthritis and grade 4 osteoarthritis. That is, in grade 4, bone touching bone. It's crucial to understand that not all arthritis is the same. In early stages, you still have cartilage. But in severe arthritis, that protective layer is worn away. This is bone on bone. And this mechanical reality changes which treatments will work for you. The limits of PRP. Let's talk about PRP. It is an excellent treatment, but its primary power is signaling. Think of PRP as high quality fertilizer. If you have a lawn that is thinning out, mild arthritis, fertilizer helps the grass grow back thick and green. But what if your lawn is just bare dirt? What if the grass, the cartilage, is completely gone? You can pour all the fertilizer you want on bare dirt, but grass won't grow. This is why PRP often fails in grade 4 arthritis. It provides a signal, but there is no tissue left to respond to that signal. The cellular solution. The cellular solution is BMAC or bone marrow concentrate and PRS. For severe arthritis, we need more than just fertilizer. We need seeds. We need a cellular solution. This brings us to the two most advanced orthobiologic treatments available today, BMAC and PRS. PRP contains only platelets. PRS contains platelets plus stem cells, MSCs, and scaffolding. Unlike PRP, which comes from your blood, these treatments are harvested from tissues that are rich in regenerative cells. They provide the living machinery, mesenchymal cells, formerly called as stem cells, MSCs, or signaling cells, and other reparative cells that can actually modulate severe inflammation, can manage the hostile environment of a severe arthritic knee. The first and common option is BMAC. This involves taking a small amount of bone marrow. It sounds intimidating, but it's a quick, minimally invasive procedure done under local anesthesia. Scientific evidence shows that BMAC is superior to PRP for grade 3 and grade 4 osteoarthritis. We process that marrow to concentrate the stem cells and growth factors. Studies, including a major comparison in 2021, have shown that BMAC provides superior pain relief and functional improvement compared to PRP in patients with advanced disease. It's a robust, powerful anti-inflammatory that changes the biology of the joint for a longer period, often 12 months or more. PRS, Platelet Rich Stroma. The second option is Platelet Rich Stroma or PRS. This uses your body's own fat tissue. But we aren't just injecting fat. We are harvesting the stromal vascular fraction, a dense network of cells hidden within the fat. PRS is unique because it acts as a scaffold. We combine these potent fat-derived cells with PRP. The fat provides a physical scaffold or structure for cells to cling to, something liquid PRP cannot do. This is critical in severe arthritis where we need to coat exposed bone and still fill defects. So, which one is better? PRP, mild to moderate osteoarthritis. The duration of relief is about 6 to 9 months. BMAC and PRS are indicated for severe osteoarthritis. The duration of relief is more than 12 months, up to 2 years. The evidence is clear. If you have mild arthritis, start with PRP. It is less invasive and often sufficient. But if you have severe grade 3 or grade 4 arthritis, PRP is likely to disappoint you. You need the cellular engine of BMAC or the structural advantage of PRS. These treatments offer a statistically significant advantage in pain relief and duration for severe cases. You don't have to jump straight to a metal knee replacement, but you do need to match the treatment to the severity of your condition. Don't use a band aid where you need a bridge. Consult a specialist for a personalized evaluation. Talk to a regenerative medicine specialist about BMAC or PRS to see if your knee can still be saved. Thanks for watching. I am Dr. A.K. Venkatachalam in Chennai.